Health Minister Dr. Phaahla has defended government's proposed new COVID-19 related regulations after President Cyril Ramaphosa announced last night that the state of disaster declaration was coming to an end and will for over the next 30 days be replaced by temporary measures which include the wearing of masks indoors and restrictions on large gatherings. The minister says the aim of the amendments is to prevent a resurgence of COVID-19 infections as has been seen overseas. Minister Phaahla joins us now on News at Prime to talk more about this. Minister, very good evening to you. Welcome to News at Prime. So the refrain from your department, having heard both you and Dr. Nicholas Crisp speak today, is that the state of disaster declaration has ended, but COVID-19 has not gone away. How nervous are you about what could happen in the next weeks, next few months with COVID?
Well, we remain nervous about the unknown because what we have learned over the 2 years is that we've come to understand some aspects of how this virus behaves, but at the same time, while we are a little bit more educated, we know that it remains also very unpredictable in terms of its next move. Just to give you an example, when we were hit by the Omicron variant just middle of November and confirmed that indeed we're dealing with a variant around, I think, 24th of November. The expectations from our scientists and modelers was that we might get a new wave middle of December or even early in January of 2022. And then suddenly we started seeing some rising infections in some parts of Tshwane, Gauteng, and then, very soon it became clear that we're dealing with something, and then we're informed that indeed confirmed that there's a variant. So currently, the expectations again are that maybe later this month, maybe middle of May, even maybe later, and as the winter comes in, we might be hit by changes again. But what we have come to know is that it's almost inevitable that something is going to happen. We don't know what is going to happen.
And what informs...
so we're learning to see what's happening elsewhere in the world.
What informs that forecast, the late April, May forecast? Is it just winter starting, or are there other factors as well which you think may push up the picture as far as COVID infections or prevalence is concerned?
Well, over the last 2 years, what has been kind of standard is that what drives rising infections, one is the more we open up, the more we interact with each other. Secondly, the inset of variants. When variants come in, then, of course, also they drive the spike up of infections and beginning of waves. So those are the driving factors. Now, as we get closer to winter, of course, we start to congregate more indoors rather than outdoors because South Africa gets quite cold most of the country. So the tendency to congregate indoors is going to be higher. And then, of course, just from the experience, they indicate that there's usually the maximum of a lull of about 2 to 3 months, and then this variant starts to rise up again, and then, of course, behavior also. So that's what the modelers and the scientists look at, and that's why the prediction that we are likely to get into some difficult situation as we get closer to winter.
We did see a surge at the end of 2021 with Omicron, which was driving a global rise in COVID-19 infections. That did not lead South Africa to much of a tightening of regulations. There wasn't a dramatic surge, at least in the very serious cases of infection and deaths compared to the previous third waves. Is there any reason to believe at this stage that a fifth wave would perhaps be more disastrous than the fourth?
Our hopes are that even when we get hit because mutations are happening, we get reports, as I mentioned at the press briefing earlier on, even yesterday I've got reports which indicated the mutations which are being picked up. We also get information from what has been picked up in other parts of the world. So the fact that there will be these mutations are going on Whether they become significant, they become variants of concern, that's a different matter. As they do happen, even if they become of major impact in terms of driving high transmission, we've learned one of the countries where we got the reports that the variant which is now dominant there, they believe it's more higher transmissible than even the original Omicron. We haven't had that experience because it's not with us as yet. So whether then it becomes transmissibility, we have realized with Omicron did not equate to high severity. So what would happen next? We will see as it's developing in other countries, if it's the same variant which is happening in some of these countries. When it comes to us, what the scientists are saying is we should at this stage be optimistic that with even though we would have loved a higher vaccination uptake, even with our middle just below 50% of coverage of adults, below actually about 45% at full vaccination of adults, even with that low rate, and then with the fact that Omicron passed through many South Africans, so some bit of natural immunity will still be there. There is no one who has absolute, certainty as to how severe and how mild it will be. So that's why our caution that this call for some leaders to say just drop everything is very irresponsible, because there are all this which we must still experience.
So given the rate of vaccination which you've referenced, along with people who've had immunity from COVID-19 infection, and the fact that deaths in the country, and this was highlighted as well in the address by President Cyril Ramaphosa when he compared the average during recent weeks to when we were seeing the worst perhaps of COVID-19, why do we need any regulations at all? Is it government's fear that if you were to lift all COVID-19 rules, you would essentially not be able to take the country back to any kind of period of regulation at all? Do you think people would resist?
Well, that's the one, if you know the social behavior of human beings, you know that once, you give in maybe certain kind of liberties, it becomes, when things change, going to be very difficult. But also just, our own experience and also learning from what has happened in other countries. We are left, we are left with very little now in terms of any, kind of controls. We are left with masks only indoors. We are left with only to say, you can have 50% of your venue, provided that you can also make sure that people are vaccinated or they are tested for COVID. And then, of course, the ports of entry that we need to have, again, vaccine proof or a PCR COVID test. That's all we are left with currently, very minimum in terms of where we come from 2 years ago. Now, the experience is really, it's not theoretical. It's our own experience, as I've said to you. We know that at the time when masks usage was very high, in the year 2000, the whole of the winter of 2000, not only did it manage to make sure that COVID is not spreading as quickly as it could and overwhelmed our health facilities, even flu was just, totally, not there amongst the people. In the clinics, in the surgeries, doctors did not see people with flu. So we know that if we just drop everything, including basics protections, including limitations of huge crowds and unprotected, we know that it's going to happen, because this thing is still here, it's still with us. We also see from what happens in other countries, as they've done exactly that. Some of them threw away everything, and then in some time, very, very soon, they have to come back and start, putting up restrictions. So it's not theoretical. It's actually from practical experience. Do
you believe then that mask wearing, at the very least, and restrictions on the larger gatherings, over 2,000 people gathered outdoors, do you believe that that should stay in place for more of the longer term, perhaps a year, another 2 years?
I would wish that we do away with all those, but what rules this is not us, it's not government. It's COVID-19, it's the virus. The day we see a situation where for prolonged period we go through, let me say even now, if we can go through the winter and we remain stable with low rate and even lower than where we are. I've just looked at the report of today. Yesterday we had the number of infections yesterday was 685. Today is almost 1,000 more at 1,538. Those are the new cases for today. The positivity rate was about 5% yesterday. Today is 6%. So it's very, unpredictable. If we can reach a very stable and then look at also, it's still, encouraging when you see that hospital admissions are still stable, still below 2,000 COVID patients in hospitals, below 200 in terms of ICU. If we remain that and also with a stable and even lower rate of infection, we go through the winter, I'm sure then we can say, look, we think we have reached a certain level of stability where this virus is just a part of the normal, like flu amongst us, then we can be able to let go. So if it was possible that we can be certain tomorrow, fine, but we know that that's not the case until we go through at least another 2 or 3 months, especially now as we go into winter where we get congested indoors. Once we have passed that and things remain fairly stable, I would be prepared to advise my leadership to say, I think we are now in a safer place.
Speaking of advising leadership, a public participation process is now essentially underway to get the inputs of the public as far as what the next course or the next set of amendments should be that govern our response to COVID-19. You said this is not the creation of new laws, but amendments, right? But some of the reaction from the public has been that they're not going to take part. Some people are saying because whatever they say, government is going to do what it wants. What say you to those South Africans?
I'll say to them that's not true. That's not true. That's why the important thing is put your views and substantiate them. If you say, I don't want a mask at all, that's not enough. You should be able to say because of A, B, C, D. We are able, I'm saying to the nation today, and as we have said before, that there is ample proof. We have proof over the last 2 years that wearing masks properly does prevent infection, especially high risk like indoor gatherings.
Okay.
And so if you say to us, remove the masks, then you must substantiate because of A, B, C, D. And if the reasons are substantial enough, then that will have to be considered.
So just on that, Minister, then, the weighting of these submissions, say you get 200,000 submissions, let's say, that say open up large gatherings without a requirement to produce a negative test or a COVID-19 vaccination certificate. Do you then look at what weight do you give to the volume of submissions, and who then advises you, who sits in the room to say this is the best course of action to take? Is it just purely cabinet, or how much influence will scientists have?
Well, first of all, let me just say again, it's not the numbers. This is not a referendum. This is not the numbers. It's not a numbers game. It's substantiating. I mean, as I say, we're left with only 3 issues now. It's the masks, is the size of gatherings, is the port of entry, all the measures which are still in place. When you say you don't agree with what is important, even if just one person, but give substantive reasons why you believe that it's not necessary anymore, that will be considered. But if we get 1 million just say no, we don't want mask, we're not really going to be able to move in that direction, because it doesn't substantiate the reason why the mask is there, which has been proven. And so the numbers do have a say, but it must be associated with reasoning. So we do have within the department a team which is busy collecting this. We look at that. Where necessary, we'll bring in also medical experts who will help us to interpret and make out those. But what I want to say upfront, it's not going to be that there are so many people saying no to this, and because there are so many.
Okay.
that must be correct.
We're running out of time, Minister, but I want to put a question past you based on conversations we've been having here on the program since last night following the President's address. I've spoken to the ACDP's Reverend Kenneth Mishre and Pastor, I think, Derek Musona, just getting reaction from the religious sector about these regulations. And Pastor Musona said to me last night that come Good Friday, his church is not going to stop anyone from attending a service if they've not been vaccinated for COVID-19 or if they cannot produce a negative test not older than 72 hours. What can government actually do in this situation during the 30-day period? Is there anything you can do to stop such going ahead?
Well, I will say that that's very unfortunate for a responsible citizen, because these measures are not there for just some kind of as a way of restricting movement or penalizing people. Very irresponsible for a leader of society to be saying that. Now we will look at when it does happen, but our approach is really to guide South Africans to say this kind of approach is safe. It's proven to be safe when you gather. And most of you are vaccinated. This is how it works. It has been proven. That's why there's similar approaches in various parts of the world. But if there are people who consider themselves leaders of people, but they just want to, defy all that, I mean, it's not really for us. It's not about, the might, but it's more about the right thing in terms of protecting lives and livelihoods. So,
Final one, Minister Phaahla, if I may, very quickly, do we know the cost yet of the vaccines we've had to destroy the expired Pfizer doses?
Well, I think there was a figure which was published, if I'm not mistaken, it was 13 million rand. That is the figure which has been published.
Thank you very much.